Our next presenter is Dr. Kathleen Brady, a McDonald Distinguished Fellow at the Center for the Study of Law and Religion at Emory University.
In my written contributions to the program, I explore some of the constitutional and related implications of COVID-19 restrictions on religious worship. Litigation over COVID-19 restrictions began to pick up as states implemented reopening plans and religious groups started to challenge restrictions that they argue impermissibly favor secular activities over religious ones. So for example, in a case that reached the Supreme Court on an application for emergency injunctive relief, a rural Nevada church argued that the state violated the free exercise clause when it capped indoor religious worship services at 50 persons, but allowed casinos and other commercial businesses to operate at 50% of building capacity, regardless of the total number of people assembled. And we've heard about that case before. I argue that there are drawbacks to focusing on demands for equal treatment, including the fact that religious groups are often not really asking for being governed by the same rules as secular entities. For example, what the Nevada Church really wanted was to maximize its ability to gather safely together in person, and its safety plan was in many respects more protective than rules applying to casinos. In my piece, I argue that another constitutional principle better captures what's at stake in these disputes. Government restrictions on in-person religious services interfere with one of the most fundamental aspects of religious practice, what for most American faiths is the lifeblood of the religious community. And as such, they should be governed by the principle of church autonomy that has begun to emerge from the Supreme Court's Religion Clause jurisprudence. This principle protects matters at the core or central mission of religious institutions from government intrusion. Of course, church autonomy can't be a principle without limits, and conflicts over COVID-19 restrictions test the limits of this freedom. These are exceptional circumstances where the state clearly has a compelling interest in protecting public health. However, these circumstances don't give governments unbounded power. The principle of church autonomy requires government officials to carefully tailor their rules to maximize the ability of religious congregations to meet safely together. The principle of church autonomy also requires more. Church and state often interact, but when they do, the independence of each must be recognized and respected. In the context of COVID-19, this means that religious leaders and government officials must work together to develop the rules that apply to religious worship. Communication and attentive and timely consideration of input and proposals are essential. Effective partnerships also build trust and reduce the likelihood that religious congregations will violate safety rules or insist upon engaging in risky behaviors, something that has been increasing as the pandemic drags on. If religious adherents believe that their governments recognize the urgency of their concerns and are willing to work with them to reduce the effect of the virus on their faith lives, all of our communities will be safer and more stable. Thanks.